All right, so we're here to talk about knee health and what would we be doing today if you were 100%, which is kind of the mindset we like our clients to come in with. So we know right away what are our goals to help you with and what are we trying to achieve, right? So if you can come in, you've already kind of given a little bit of thought to where you want to go, let us know right away, and then we're going to kind of get started. So what's it like to rehab your knee with Lift Clinic? This really depends on what the issue with your knee is. And today we drew a little bit of a picture of our knee here with our femur, our tibia. We have our meniscus, lateral collateral ligament, and medial collateral ligament, ACL, PCL, a little bit of our patellar tendon here, imaginary kneecap that'll be sitting in front of this. The point being, it is a little bit of a complicated joint. In a sense, there's lots of things that could potentially be going on here. Each of these structures sometimes will have some sort of pain or injury, and there are probably an equal number of structures that are not shown that could be generating pain for you. You know, really it's just our job when you come in to first look at what do we think is maybe the diagnosis, what's causing your pain, and two, why? Why are these things happening? We need to be able to kind of look at it, break it down, figure this out so that we can start getting to the root cause rather than just treating the symptoms at the knee. The way that we assess the knee, similar to how we assess everything here at Lift. The first thing we'll do, we're going to ask you a whole bunch of questions. We want to understand what's going on, how long it's been going on for, and even kind of details of things that you might not even think are super important. But we need to know basically what are all the things that might be contributing to things being painful. For example, stress or breathing, or what's your office job like, or you know, you're sitting at a desk versus you're up on your feet all the time, stuff like that. It's our job to kind of figure out if that's relevant or not. The other things we look at with how to assess the knee, really we're going to look at a head to toe movement assessment. So we're going to start with, like, can you touch your chin to your chest, look up, turn to the right, turn to the left, reach up and behind. Can you touch your toes? Can you put your arms overhead, do a back bend, rotate through a full body rotation? Can you stand on one foot and balance? Can you get down into a deep squat and then put your hands down beside your feet? Each of these movements triggers a whole different line of assessment. If you can do them perfectly, then we're kind of like, wow, we can rule out all of that group of issues. Whereas if you have issues with any of those movements at all, we're able to kind of see that really quickly and be like, okay, here's something that could be a contributor, and would this be relevant to your problem? So the head to toe assessment kind of gives us context about whole body movement and how it might be affecting things locally. Then we're going to get into that more detailed regional and specific assessment for the knee, which is really going to extend especially from the low back and hip down to the foot. So we need to kind of understand the knee is just in the middle of all that stuff. So here at Lift Clinic, we have a few different disciplines: physio, chiro, massage therapy, and strength. And the question is, how do these different disciplines treat knee pain differently? Ultimately, it just comes down to the training of the individual. So we all start with our basic training, which there are some fundamental differences there, and then each of us has our own experiences and kind of starts to diversify from there. It's our job to kind of know as a team what our strengths are and which one of us might be able to best help our clients, right? So that's something that we spend a lot of time on every week, training together, so we're able to better help understand, okay, you know what, this is where I can take you, and now this is where massage therapy might help, or this is where chiropractic might help. A little bit more background on it. I mean, physiotherapy has a pretty broad scope, so we're going to be able to do things that are looking at like muscles, joint mobilizations. We're going to do things like sometimes IMS, sometimes some exercise and stuff like that. Chiropractic starts with a lot of training in their discipline about joint mobilization and manipulation, and often is kind of associated with those like let's pop or click something into place. Massage therapy ultimately, you know, starts out by treating muscles a lot, but also can incorporate some joint mobilization, and sometimes they're going to have some really good exercise stuff there as well. Whereas our strength group, you know, is really specializing in that exercise side of things. And for us, that spans that whole rehab to performance spectrum. And so there are times that their scope and level of practice we'll take them into the field, take them like onto the field or onto the court, which is a little bit beyond where our physios and chiropractors and stuff like that usually end up going, okay? Okay, so what are the most common knee injuries that we treat? We treat a whole range of knee injuries. We've kind of commented on it. There's so many different structures here. You might think we treat acute knee injuries and we treat chronic knee injuries. So, you know, is it something that just happened because you had a twisting injury or you had a fall, you had an impact, and that's what we call our acute injuries. That's when we're often ending up looking at a lot of these structures here and saying, you know, I didn't have any knee pain, now I do. What's the issue, right? So you're gonna come in, we're gonna kind of check those things out. On the other hand, things that kind of come on a little bit more gradually, those are your chronic injuries. But let's just kind of consider some examples of those. So we're going to often see maybe pain on the inside of the knee here with something like arthritis. If we're like a little younger crowd, we're doing lot of running and jumping. Maybe we're going to start getting some pain in, around, or underneath the kneecap. This is one of the most common issues that we see. So patellofemoral pain syndrome, or sometimes like straight down here in the tendon, which would be like runner's knee or jumper's knee. So we see those things like a lot. When it comes to more significant traumatic injuries, we see a lot of ACL. We see a lot of meniscus injuries and sometimes MCL. Those are the most common, but we have seen some pretty significant injuries like quadriceps tendon tears and fractures and stuff like that around the knee as well as a whole range of muscle strains that come up quite often. Okay, so the question is, how does optimal knee function help you to run, jump, train, and play? And really, like these movements, it doesn't happen in an isolated thing at the knee. It happens as like a whole body movement pattern, where maybe we'll start by looking at the lower body movement pattern in running, jumping, but it's really the whole body. So it comes down to being able to, well, I guess for running, we're gonna have that kind of like triple extension. That's coming in this sort of a pattern, and for jumping as well, we're going to have that kind of triple extension that's happening out of this movement pattern. So when you're coming in, if your goals are kind of in that line of things, we're going to look at those movements. We can look at your run, we can look at your jump, we can look at your landings, and be able to kind of break down components of that so we understand how everything is functioning, right? Ultimately, you want to be powerful and stable in these movements. And so we can kind of assess to see if you have any leaks in your strength, stability, or if you have any issues that are affecting your mobility. It's less common for people to have like specific mobility issues around the knee unless they've had some kind of injury history, but it's very common that we'll have mobility issues around the hip that might be affecting your knee. Or we'll have some people who come in with like performance goals who find that at times when they really try to push their performance, that's when their knee starts to get a little bit sore and become a little bit limiting. Next thing is, you know, training and playing. So it starts to get us thinking about, okay, we're going out to do stuff now, whether it's on a court, on a field, up in the mountain. And so how are we kind of caring for our knee at that point? Knee injuries is one of the biggest things that we're always looking to kind of prevent. So we're thinking performance, we're also thinking prevention and longevity, right? We want to keep you doing these things for a long period of time. So sometimes we're just going to be as simple as screening for some really simple and obvious risk factors, like the muscle balance around the leg. What's your quad strength like? What's your hamstring strength like? Is it fairly balanced? And is it even between the two sides? We're also going to look at things like, what do you look like when you're doing a squat or a single leg squat or a jump movement? Are we seeing any sort of like valgus where that knee is collapsing in a little bit? And is that because of some sort of an issue around you know, your low back or your hips or your foot? Is it something that we can treat with manual therapy, or is it something that you just need to train and actually get some coaching and understand the mechanics of movement so that you can train that out of the way that you move? Okay, so the question is, how can lift help you to achieve optimal knee function? So again, obviously it starts with our assessment, but let's think about what we can do from a treatment point of view as well. So once we have that assessment in hand, We're able to identify, like, is this an issue that's going to benefit from manual therapy? Is it something that needs mobility? Is it something that's going to benefit more from just building some basic levels of strength? Where do we need to build that strength? Is it like here around the knee, or is it around the core and hip? Is it around the foot? Right? So what parts of our system are we going to be working with? Those are some of the first questions we need to answer. Once we have that stuff moving, then we can also be maybe sometimes extending beyond that when we're looking at optimal function. Okay, now we're thinking about things like running, jumping, looking at your mechanics, looking at what have you learned? How have you been trained? Have you been trained? Okay. What are you doing in the gym? Are you aiming to get into the gym? And have you been coached? Okay. So being able to kind of help you, whether it's here with our team, or whether it's sometimes getting a little bit further to working with a strength coach or a sport coach that maybe is in the community, that's going to really be meeting the needs that you have to achieve that optimal knee function as defined by you and what it is that you want to be doing when you're at 100%.